Crutches are an important tool that can be very useful after you injure your leg or after surgery. We're going to show you some different tips and helpful information that can help you properly use them and help to keep you safe. Your crutches come in all different sizes. On the bottom of the crutch, you will find different height measurements, as well as on the side, a sticker that will indicate the weight limit measurement. Your healthcare provider will help you choose the proper size crutch and help get you fitted. So it's very important to get the crutches sized properly for each patient. If you are the patient adjusting them for yourself, the caregiver adjusting it for the patient, or a healthcare provider adjusting it for a patient, it can be very, very easily done. Ask the patient how tall they are.
I am 4'11", ma'am.
4'11". There are height measurements down on the bottom of the crutch. Use that as a guideline. When you have the crutch height adjusted, there should be about a 2-finger space between the top and the armpit of the patient. So here you can see that this crutch will have to go up a little bit higher for the patient. Okay. Again, it should just be about 2 fingers space. Adjusting the hand part is going to be the next important part. When the patient has their arm down by their side, where their wrist bends is usually a good spot to try to line the hand up at.
Okay.
So I just moved it up to the top handle. Okay. And then recheck the position. Go ahead and turn for me. Once the crutch is adjusted, there should be a little bit of a bend in the elbow. This will allow you to push through your arms when you're walking with the crutches later. Okay. You may have to adjust the crutches depending on what height of shoes you're wearing and things like that as you start to walk. So when the arm is down by the side, you want to make sure that where the wrist bends is at approximately the height of where the handle is on the crutch. And the height of the crutches should be about a 2-finger space between the top of the pad and the armpit. After you get the first crutch size, you want to make sure that you get the other crutch size to the same height so that when you're walking, things are comfortable.
Okay.
How does that feel for you?
That feels pretty good under my arms. I have room. It's not rubbing.
When walking with crutches, I highly recommend wearing a good tennis shoe or sneaker that has traction on it. Please do not wear flip-flops, open back shoes, or high heels, as these are not safe shoe wear. Now we're going to teach you how to walk with the crutches. When you're walking with the crutches, the idea of the crutch is to take pressure off the leg that is affected. You're going to place the crutches out in front of you just a little bit, and you're going to take a step with the affected leg. And as you take a step, you're going to push through your arms to take pressure off of that leg, and then take a step with your unaffected leg. So it's going to be crutches, affected leg, pushing through the arms, and then your unaffected leg. Let's try that. So let's put the crutches out just a little bit in front of you. You don't want to put them too far.
Okay, how about right there?
That looks great.
Okay.
So let's go ahead and take a step with your affected leg. Good. Now as you push through, I want you to push through your arms. Perfect, and then take a step.
Okay, let me do that again. Right here.
Good.
Bad leg.
Good, push through. Perfect. Now as you start to get more comfortable with that, you can move the crutches and your affected leg together.
Okay.
Okay, and you can step through with your unaffected leg.
Okay, I'm gonna do this one more time.
You move the crutches and your affected leg together, and then step all the way through with your unaffected leg. So crutches, affected leg, and then stepping all the way through. You're still pushing through your arms each time you take a step with your affected leg. If you can't put any weight through your leg, you can either put the leg out in front of you or behind you, whatever's more comfortable. Again, you're going to put the crutches out just a little ways in front of you, really push through the arms, and just take a hop. Okay, I highly recommend starting with a small hop with your unaffected leg, and then as you become more comfortable with the crutches, you can start to increase the size of that. But you always want to start small to stay safe. Again, leg behind you or in front of you, crutches out in front of you. You're going to push through your arms, and when you're pushing through your arms, you should be squeezing between your arm and the side of your chest, your ribs. Okay, and you're going to push and hop, push and hop. After a while, you can probably progress yourself to using just one crutch. If you're still limping, you definitely need to have something to help take pressure off of that leg. Since we're using your left leg as your affected side, you would actually use this crutch over on your right side here. Okay? It goes along with the normal walking that you would do, and it will help keep the pressure off of that affected leg.
Okay.
So what you would do is still put the crutch out in front of you, take a step with that left leg, push through the arm, and then take a step with the right.
I gotta take a bigger step.
Only if you're comfortable with it. Good. So if your affected leg is the right leg, you would put the crutch over on your left side. Same thing if you were to use a cane. If the affected leg is the right leg, you would use the cane over on the left side. If the affected leg is the left side, you're going to keep the cane or the crutch on the right side.
Okay.
We're going to teach you how to come up to sitting and standing properly. If you're in the chair or sitting on a bed, I want you to scoot towards the edge. If you have an armrest on the chair, you can use that to assist you up. I highly recommend, if you're a taller patient, to always sit in a chair with an armrest. With the crutches, you're going to put both of them together and you're going to stick your hand on the grips here. When you come up to standing, whichever leg is affected, you can put it out in front of you a little bit to help take some stress off of that leg, whether it's the knee, the ankle, or the hip. Next, you're going to push through your unaffected leg, push through the hand that is on the crutches, as well as the hand that is on the armrest, and slowly come up to standing. As you come up, bring your affected leg up next to you. Good. Make sure you have good balance. And then bring one crutch over to the other side. There you go. And then go ahead and place this crutch in. Now you would be ready to walk. If you're ready to sit back down, you're going to bring the crutch back over to the same side. Replace your hand here. Make sure that you've already scooted back to the chair or the bed so that both legs are touching. That way you know you're going to sit on something. You can reach back with your other hand for that armrest. And then again, stick that leg out to take some pressure off and slowly sit down. Good. It's up to you with what side you want to have the crutches on. Some people like to have it on the same side as their affected leg. Some people like to have it on the unaffected side. Go with what's comfortable for you. It's important to know how to safely go up and down the stairs. Most people have stairs either to get into their house or once they're inside the house to go between the main level and the bedrooms. I'm going to show you how to use the stairs. If you do not have a set of railings to use, you are going to step up with your good or unaffected leg, push through that leg, and then bring your affected leg and the crutches up with you. Good foot up, and then the affected leg and crutches follows behind. If you have a railing on your stairs, I recommend using it. You're still going to step up with your good or unaffected leg. You just now are going to put your hand on the railing. You can move your other crutch over to the other side or have somebody else hold it for you. Step up with your good leg and push through. You can use your hand on the railing to help steady yourself and bring your affected leg and crutches up with you. So up with the good, and then bring the crutch and affected leg up with you. If you can't put any weight through the leg, you're going to put it behind you as you go up the stairs. Still going to use the hand on the railing if you have one and pushing through the crutch. You're going to hop up and then bring the crutches up with you, never placing any weight through that leg. Again, pushing through the crutches and the railing to hop up and bring the crutches back up with you. If you can't put any weight through your legs and you don't have a railing, you're going to still use the crutches on both sides. Put the leg behind you. You're going to push through your arms, hop up, and then bring the crutches up with you. If you are not weight bearing, I highly recommend a family member to be near you for the first couple times that you do the stairs. Have them stand over on your affected side and slightly behind you. You can also put a belt around your waist and have them hold on to the belt to help keep you steady and safe. When you're going down the stairs, you want to step down with your affected leg first. You're going to put the crutches, your affected leg, and then follow with your good leg. Crutches, affected leg, and then follow with your good leg. If you have a railing, be sure to use it. Again, you can put both crutches together over on the same side or have someone hold one of the crutches for you. Hold onto the railing. Still step down with the crutches and the affected leg first, followed by your good leg. If you can't put any weight through the leg, when you're going down the stairs, you want to be sure to put the leg out in front of you. If you put it behind you as you're going down the stairs, there's a good chance that your foot might hit on the step behind you. So place the leg out in front of you, put the crutches down, use the railing to help steady yourself, push through the arms, and just take a nice light step. Again, you can have family members assist you. If you're non-weight bearing and you have no railings, you're going to put the leg out in front of you, put both crutches down, and then take a nice leg hop. Be sure to have family members nearby if you're not comfortable. When it's time to leave the hospital, we want to make sure that you can get into the vehicle very safely. I find that rolling the window down on the passenger side can give you another place for you to grip with your hand and help you safely get into the car. Put the seat all the way back before the patient gets into the vehicle. Sometimes I like to put a sheet or a blanket on the seat itself. You can use that to help move the patient into the car and position properly. Be sure before you get out of the wheelchair that the brakes are locked.
Brakes on. Brakes on.
Go ahead and scoot forward to the edge of the chair. Okay. And we're going to stand up. Remember, you can use this to help you. Let's go ahead and slowly step down with your affected leg. Good. Take your time turning. And you can reach back with your hand for the head of the seat. Good. And slowly sit on down. Good. I want you to scoot back as much as you can. And this is where if you need the sheet to help pivot the patient in, you can use it. But we'll always try to have the patient do what they can. Once you're home, if you're the family member helping, I want you to grab the crutches and open up the door for your family member. Roll the window down. If you've put a sheet or a towel down, you can now use that to help pivot your family member out. Okay. So we're gonna go ahead and swing our legs on out. You can help me, I'm gonna help you as well. There you go. Good. So to get out of the car, we can use your hand over here on the window. You can use your hand on the seat of the car, or you can use your hand on the crutches. I want you to use what is most comfortable for you, and I will help you as you need it. Very good. Let's go ahead and put one crutch under each side. Very good. And now we're going to go inside the house. So let's step up with our good leg. Good. All the way up. Bring the crutches, everything with you. Perfect. So getting into an SUV is a little bit different than a car. The height of the seat is going to be a little bit higher. Just be very, very patient with your family member. Keep turning. If you have two people to assist you in getting into the car, have a person over on the driver's side and have a person over by your family member. Go ahead and sit on down for me. The person over on the driver's side can grab the sheet that your family member is sitting on, while the person on the outside of the vehicle can help grab the legs and move them in. On the count of 3. 1, 2, 3. Now that you're home, it's time to get your family member out of the SUV. Let's open the door. Again, you can use the window roll down as the arm or hand rest. We're going to go ahead and swing those legs out. I'll help you. Okay, now this is a little bit higher. I want you to scoot so both feet are touching. Perfect. Let's use your hand up there. Let's stand on up. Good. One crutch under each side. And let's go home.
Okay.
I always like to inform my patients and their family members of some different safety tips to think about when they return home. Be aware of your surroundings when you're outside. Sidewalks can be uneven, which can cause tripping and make walking very difficult. Also be aware of the weather. Rain, snow, and ice can cause slick, slippery conditions. Once you're inside the house, be mindful of the different flooring surfaces that you have. Some people have carpet, hardwood, and tile. The transitions between each one might be a little bit different when walking with the crutches. If you have throw rugs, be sure to roll them up or be sure to tack them down so that they aren't a tripping hazard. Wherever you might be sleeping, whether it's the bed or the couch, make sure that there's a clear path between the bedroom and the bathroom. Crutches should not hurt when you're using them. Be sure that you are not leaning on the crutch with your armpit and that you're using your arm and the side of your body to keep the crutch in place. If it's still hurting, try readjusting the crutch to a different height with the tips that we showed you, or follow up with your healthcare provider. Good luck in your recovery.